आदरणीय दर्शकवृन्द, नेपालीले हारेको र युद्धले जितेको इतिहास आजसम्म बनेको छैन। सगरमाथा अग्लिँदै गर्दा नेपाली स्वाभिमान होचिने कुरा पनि त भएन। एकाध अपवाद होलान्, राजनीति अस्थिर होला, केही नेता भ्रष्ट होलान्, विकास क्रम ढिलो भयो होला, तर केही क्षणको बादलले सारा दिनलाई अँध्यारो बनाउने त गर्दैन नि। कुनै दिन घमाइला नहोलान्, तर अँध्यारा त हुँदैन नि। गत वैशाख 12 गते नेपालमा भएको प्रलयकारी भूकम्पले राजनीतिक अव्यवस्थाका कारण थला परिरहेको राष्ट्रमा अर्को एउटा पीडा थपिदिएको यथार्थ अब नौलो कुरा रहेन। नौलो कुरा त एक नेपालीले अर्को नेपालीलाई अप्ठ्यारो पर्दा काँध थापेर गरेको सहयोग, अन्तर्राष्ट्रिय समुदाय तुरुन्त सहयोगका लागि पुगेको वर्तमान र युवा समूह जुर्मुराएको यथार्थ हो। विपदमा जुट्नु मानवीय आकस्मिकता होइन, स्वभाव हो भन्ने कुरा प्रमाणित गर्दै नेपाल करिब 9,000 जीवन गुमाए पनि, करोडौं क्षति बेहोरे पनि नडगमगाइकनै फेरि उभिएको छ पुनर्निर्माणका लागि। चुनौती धेरै छन्। पुनर्निर्माणको कार्य त्यति सजिलो कुरा होइन, तर यो अवसर हो। खुसीको कुरा के हो भने युवा पुस्ता अब तयार भएको छ नेपालको निर्माणको लागि, नयाँ नेपालको पुनर्निर्माणको लागि। हामीले यी कुरा गर्दा गर्दै समय भने रोकिँदैन। मनसुन नजिकिँदैछ। नेपाली जनजीवनलाई कष्टकर यात्राको लागि थप चुनौती दिनको लागि भूकम्पको धक्काले कहाँनिर ढल र खानेपानीका पाइपहरू फुटाइदिएको छ थाहा छैन। मनसुनमा महामारी फैलिनु अघि जनचेतनामूलक कार्यक्रमको सर्वसुलभता, शौचालयको व्यवस्था, सरसफाइमा विशेष ध्यान दिन सकिएन भने नेपालले अर्को विपत्ति भोग्नुपर्नेछ। जसरी हेटीले 2010मा गएको भूकम्पपछि अहिलेसम्म पनि त्यहाँ हैजाको महामारी अझै पनि उन्मूलन भएको छैन। विदेशी सहयोग बाढीकै रूपमा पुगे पनि त्यसको उचित प्रयोग हुन सकेन र जनचेतना आउन सकेन भने हेटीमा गएको भूकम्पको 5 वर्ष बित्दा पनि हैजाबाट त्यहाँका जनताले मुक्ति पाउन नसक्नुलाई नेपालले गम्भीर रूपमा लिनुपर्छ। यसै सन्दर्भमा हामीले अमेरिकाको मेरील्यान्ड राज्यको एक विश्वविद्यालयमा अर्थात् युनिभर्सिटी अफ मेरील्यान्ड अन्तर्गत महामारी रोगको व्यवस्थापन शिक्षामा विशेष भूमिका निभाएकी र हैजापछि उक्त महामारीको रोकथामको लागि एउटा टोली नै लिएर हेटी पुगेकी एक कुशल व्यवस्थापक मिस पेट्रिसिया स्यानन जोन्ससँग कुरा गरेका थियौँ। मनसुनमा नेपालमा कुनै महामारी नफैलियोस् भनी त्यहाँ आफूले सिकेको र जानेको कुरा जानकारी गराउन तथा नेपालको वस्तुस्थिति बुझी यहाँ आएर यहाँका स्वास्थ्य निकाय र इभन सरकारलाई समेत आफ्ना सुझावहरू प्रस्तुत गर्नको लागि जाँदैछिन् मिस पेट्रिसिया स्यानन जोन्स। र उहाँ जानुभन्दा अगाडि हामीले हिजो मात्रै लिएको अन्तर्वार्ताका केही अंशहरू हामी यहाँहरूलाई प्रस्तुत गर्न चाहन्छौँ। स्वागत गरौँ मिस पेट्रिसिया स्यानन जोन्सलाई। डियर अडियन्स, नमस्ते। Vision for Nepal Foundation welcomes you to the American Conversations. In today's American Conversations, we are talking with Patricia Shannon Jones. She's the director of Immigration Outreach Service Center in Maryland. The reason why we are talking to Ms. Jones is because she is an expert on epidemiology, and she was in Haiti when earthquake struck in Haiti in 2010, and before the cholera and after the cholera broke out, she was there helping people get treated and work out for the sanitation issues as well. Now, and monsoon is very fast approaching, Nepal may have issues as the sewage may have broken and the water supply lines also may have broken. Who knows what's going to happen? But before things happen in the wrong direction, Ms. Patricia Jones has decided to go and assess the situation, and she's flying the day after tomorrow on the 7th of June. Before she flies to Nepal, she agreed to talk to us, and we are very thankful to her. And at the same time, I just wanted to welcome Ms. Jones and wanted to share her experience with you. Ms. Jones, we would like to welcome to the American Conversations.
Thank you so much, and namaste.
Namaste.
It's a pleasure to be here.
Thank you so much. And on a very short notice, we invited you for the talks, and you accepted our offer. We're very grateful.
It's my pleasure. Thank you very much.
As we have already discussed informally about the situation in Nepal, you are very much aware about what happened in Nepal on the 26th of April. A 7.8 Richter scale earthquake devastated the country's center area. About 10,000 people have lost their lives, and millions of others have lost their houses, and thousands of them have, been injured. In such a situation, monsoon is very close. You decided to go to Nepal to assess the situation, and for that, on behalf of Nepal, Nepali government, and diaspora Nepali community, we'd like to express our sincere thanks.
Well, it's my pleasure to go. As director of the Immigration Center, we have a large population of Nepali people here in Baltimore, and we're very close to them. And so this touched our hearts as well. And so my desire is to go there and be of support to my friends and family here who are now in Nepal working with their families. And so my hope is to go there to be of assistance to these folks who are friends of ours and help to assess the situation as well as help to make people safe for when the monsoons do come. We're hoping to help put roofs back on houses, perhaps, and perhaps just to supply food and some sort of assistance that will make them safe and able to get through the next couple of months.
So are you going with the team to Nepal, or you are going alone?
Well, I'm going alone on Sunday. There are two of our friends who are already there. They are Nepalis who are U.S. citizens, and they've gone back to help family. And then we have two others who are coming also a day after myself. So there will be 5 of us there in the team, if you will. And we will be working to try to help folks, probably more in the villages than in central Kathmandu. We will work out in the villages, probably closer to where the earthquake actually occurred, in the epicenter, rather, of the earthquake.
In the district of Gorkha.
Yeah. So just as comparison, we know that the earthquake in Haiti was a 7. I think you may have mentioned that the earthquake in Nepal, initially the first earthquake was a 7.8, and then following shortly after in May was a 7.3. The difference is, I think, that the aftershocks in Haiti ended more quickly than they're ending here in Nepal. In Nepal,
they
we're
are still
hearing
experiencing it.
Daily aftershocks, sometimes 3, 4, 5 aftershocks a day. And that's very worrisome because, in Haiti, people came back to the city, settled into tent cities, but came back to the city. I think the fear now is that many buildings are suffering more damage as the tremors go on, and that there's a great fear to return to the cities. So this is very worrisome for us. The difference also between the two earthquakes is that the earthquake in Haiti happened primarily in the area of Port-au-Prince.
That's where the epicenter was.
In the epicenter in Haiti. In Nepal, the earthquake, initially the 7.8 earthquake was more northwest of Kathmandu, and then the 7.3 earthquake was northeast. And so this took a little bit of the brunt away from Kathmandu itself, whereas, as we know, in Haiti, more than 200,000 people died. So far, Nepal has been very lucky and I hate to say lucky, but have only lost 10,000 compared to Haiti. And so we pray every day that the situation will remain stable there in Nepal. The other advantage I think that Nepal has is that a number of hospitals were destroyed in Haiti. And of course, there were many destroyed in Kathmandu, but there, I think, are about 26 hospitals in Kathmandu, but 11 of them had been retrofitted in order to prepare for the possibility of earthquake. And so I think that puts them in a good place in terms of being able to care for the people. I think in Haiti, as comparison, there were 1.5 million people who were displaced and then wound up living in the 10 cities. I think Reports I'm hearing is that the numbers are getting much higher, perhaps in Nepal. I've not heard any definite numbers at this point. So I think there are a lot of things to think about and to worry about as we go to Nepal, and many of them are centered around just preparing for the monsoons. The earthquake in Haiti happened in January. That gave them a great deal of time to prepare for the rains, and that's not so with Nepal. The earthquake April 25th, and then again in May, and now continuing tremors. There's been very little time to really prepare thoughtfully for the monsoons and to keep people safe. I think the other concern is that as the rains do come, if the tremors continue, this may make things kind of unstable in the country. So we're very hopeful that we will get there and be able to help in some way to help people prepare for the coming months. My goal would be to go now and then perhaps to return in the fall, after having done an assessment and been there, to return in the fall to perhaps do something that's a more concerted effort to work with some of the villages.
Great. So here at this time, you went to Haiti also to assess the situation and help out during those times of epidemic. And your background in health sector, you were with the Johns Hopkins University.
No, when I went to Haiti, I was there to help out with a lot of the logistics around a grant. Mm-hmm. The grant was funded to the Institute of Human Virology, which is at the University of Maryland. And I worked with the University of Maryland School of Nursing and with a group there who does global health. And so I went there primarily to help with a lot of the logistics around strengthening the institution of healthcare in Haiti. So this would be institutional strengthening of nursing and medical care in Haiti. And so I was there to help to plan meetings, plan and plan the logistics of getting equipment into the country and things like that. My nursing background made it easy for me to do that in some ways, and my nursing home administrator background also made that easy. So I was able to use all those skills to help in Haiti. While I was there, the cholera outbreak did occur, and so we worry about infectious diseases, very much so. It was a serious concern in Haiti, and the government had to plan very carefully to teach people how to avoid becoming ill with cholera and many other infectious diseases. So that will be important also in Nepal.
Yeah, you had a pretty challenging and at the same time a leading role in addressing the epidemic in Haiti when the cholera outbreak occurred. So we don't know. Maybe not such things happen in Nepal. Let's pray. But if something of that magnitude happens again because of the rain coming, and who knows under the ground what has happened with the sewage system, if it mixes with the water supply, situations will be really, really dangerous and very risky for the large number of people in Kathmandu. In such a situation, what will be your will you be meeting with the government officials and share the experiences you had in Haiti?
Well, first of all, my role was not a primary role in Haiti, but I was there during the epidemic, certainly took tours of areas where people were being treated for cholera, and was also very aware of what was being done by the government there and the healthcare providers there to try to teach the people about healthcare procedures to take to prevent the spread of cholera. I would like to think that I might have some of those skills that could be useful. At this point in time, I've made contact with some of my colleagues that I've worked with at the University of Maryland, and I'm hopeful that maybe we could make some inroads to discuss this with some of the folks who handle healthcare and governing the country in those regards. I don't know that we have no plans for that immediately, but I would love to consider that.
Going back to Haiti's experience, in Nepal, the situation is kind of a little more precarious because soon the earthquake happened. There's a very little window of maybe 2 months. 1 month already passed, and the government was not effective, and the rescue operation was pretty slow. But here, the reconstruction efforts are going to be a very, very long process. In that situation, the monsoon is coming. how do you think the government of Nepal should do to avoid the epidemics?
I think the most important thing would be for the healthcare ministry, and as I say, I've not had a lot of contact with them, but for the healthcare ministry to step up to begin educational programs. And I know that's very hard in a country that's currently undergoing such trauma, but to step up and try to teach people how best to prevent cholera, hand washing, and the necessary things that they have to do to be sure that they are getting safe water and not being infected with cholera or any other infectious diseases. So I think this will be important for the government to look into and try to prepare for. Cholera hit Haiti very quickly and quickly got out of control, and so it would be very important to step in and try to get things, education programs in place before it becomes a problem.
Yeah. So in Haiti, soon after the cholera hit the country, after 5 years of the country being suffering from the cholera epidemic, it is still suffering because it is still infectious and it's still affecting the population. Mm-hmm. So in order for not that to happen in Nepal, the preventive measures are very important because the cholera is not yet there and we should not be welcoming that pandemic there. So for the preventive measures, don't you think that the healthcare ministry and the international community should be proactively working on that before monsoon comes?
Absolutely, absolutely. If that is possible. I know that with the situations the way it is, particularly in the villages, it's very difficult to potentially get information into the villages, but I think it would be very important for the healthcare ministry to get out, to talk to people about what the protective measures would be, and to work with them to spread that word throughout the communities. Very important to prevent the outbreaks.
Why it is taking such a long time in Haiti to address the issue of cholera? For 5 years it's still there.
For 5 years it is still there. I believe that they made great strides initially after the first outbreak, and they reduced the number of people who were being infected and spreading the disease. But it is something that does still exist, and that's probably related to the ability to spread the word and to really educate the people across the country. The country is very impoverished and still suffering from the after effects of the earthquake. And so in dealing with the situation, not only do you have to consider how to teach people and how to educate them about the situation, but also their current living situation, which is so very difficult and continues to be difficult in Haiti. It's greatly improved. People have moved out of so many of the 10 cities, but there's still problems across the country.
Ms. Johns, you have a greater experience as an administrator in the health sector. Mm-hmm. You have addressed the public through the private health institutes. Mm-hmm. So in Nepal, have you ever been to Nepal?
I have not been to Nepal.
Yeah, but Nepal runs in a kind of a little traditional way, mm-hmm. where government presence goes in a very slow manner, unlike in the United States where you work. So in such a situation, in a government setting where things don't usually work in a fast manner, how would you expect Nepali government health institutes and the private health institutes to come together and work effectively so that the epidemics do not occur?
My thought about that, one of the things that happened in Haiti was that the local universities were drawn into the strengthening of the institution of nursing and medical care. And I think that might be a very important tact for the government, the health ministry, to take, to draw in the universities, the local universities that may be teaching healthcare, might be teaching nursing, might be teaching medical doctors, to draw them into discussion about how best to plan and implement a course of action that would prevent the spread of infection.
So the course of action should be built, and then the government and the private institutes should come together to work
Come together to implement it, yes. I think that would probably be an excellent way to do it. This would draw upon not just the universities, but also or the schools of nursing and medicine, but also could potentially involve not just practitioners, nurses and physicians, but perhaps even the students at the schools who would be able to become part of that initiative to help to keep the country healthy.
For keeping the country to be healthy, there was one small incident where World Food Program sponsored food had gone, but the food was already expired and it was really, really in a bad condition. If that kind of things happen again or repeat again, and epidemics happen, it will be uncontrollably painful for the country. In order for that not to happen, what should the health ministry do in order for making sure that the products that are coming from outside or the products that are there are adequately monitored and the right products are in the people's hands?
That's a very tough question. I don't know how Nepal handles that now, but certainly there should be some type of procedure put in place to either inspect or to organize the arrival of goods into the country to make sure that the goods are safe. Any products, any food, or any donations coming into the country are safe for the population. And I don't know how the Ministry of Health currently does that. And I'm sure it would be very difficult to step that up, but I think that's probably a very important issue that needs to be addressed, certainly.
Did you have any experiences of such type in Haiti when you were working there?
I did not. As I said, most of my work was to strengthen the institution of nursing and to work with those who are strengthening the institution of medical care. And my work was more in a logistics manner, trying to help people as they brought things into the country. Most of the things we were bringing in were equipment and things that were needed for healthcare in the hospitals or even at the university level. So we weren't as concerned for ourselves about what may have been coming into the country in terms of food products and whatnot. But I think this is a very serious concern. I wasn't aware of it. Thank you for making me aware of it. I do think this is something that the health ministry needs to be very concerned about and look into and see if there is some way to prepare and prevent the influx of equipment or food that's not up to par, not safe.
Yeah, and then the other thing is Nepal's preparedness to this magnitude of natural calamity was very poor. And if health issue of similar magnitude occurs, it will be very poorly prepared. So in that situation, do you have any suggestions to Nepal government or international community as to how to be prepared before anything unexpected or unimaginable happens in the health sector?
Right. I think that one of the most valuable things that can be done is for Nepal to reach out to some of the large institutions around the world to help them to deal with this tragedy and to try to prevent it. So to get people who have been there, been on the ground in other situations that have been calamities, just as you've expressed, and perhaps find ways to plan and implement activities that will help the country recover in this situation rather than trying to do it all themselves. If they were to reach out to many of the big universities, I'm sure people would be very interested in trying to help the country recover.
Ms. Shannon, now I would like to get to the softer side of our conversations after this little sadder aspects of it. What inspires you to come into the service sector, the humanity?
I've always been somewhat in the service sector doing nursing, nursing home administration. But since I have been actually retired, I took an early retirement, I have been challenged by my church community. And my church community is a very broad-based community from more than 45 different countries. And that has brought me to understand a great deal more about our world, about the global connectedness of us all. And so it brought me to do immigration work here in Baltimore. I actually am a second-generation immigrant. My grandfather
Yourself?
came here. I am. My grandfather came here because he was speaking out about social, economic, political things in his country. There had been a famine. It had been a very difficult time for our country. And so he came here seeking
Which
a
country
new
is
life.
that?
Ireland.
Okay.
He came here seeking a new life, and so each generation has done a little better. We're very proud of our home country, but also very proud of what we've done here.
Yeah.
Because of that, I am touched by people who have come here to find a new life, but also still support family at home. So I see both sides of this. I see the people who've come here to lead a new life, but I see family at home that still needs support as well. And so as a result of that, I've been very touched by that. And I've been very touched by the Nepali community. There are many Nepalis here in Baltimore, as you know, and I've been very touched by their journey. And so when this happened, I was immediately pulled into it, wanted to come. I was mourning with them about the disaster that's going on there, and wanted to do something to make it better. I've always been touched by Nepal, wanted to go there to see the stupas, the monasteries, all of the things that Nepal was famous for. And now I feel like I just need to go to be of service to the country.
Yeah, it's a call to duty, it looks like.
It is a call to duty. It is indeed. It is
You
indeed.
wanted to go see the monasteries and beautiful temples, but I think almost 25% of them in the valley where the earthquake had the hardest impact have been destroyed. That's very sad to see.
It is.
On the television.
It is. And so I hope to, I just want to walk. To me, Nepal, because of the monasteries, the temples, I want to walk on sacred ground. I want to be there to help people who live there and make a difference. I want to show the compassion that so many of your country live, compassion for all of our brothers and sisters, and to be there to be of help.
So after this visit of 2 weeks, having an assessment of what is required, do you have plans to ask your community or places where you have influence, or even the U.S. government to tell them, hey, Nepal needs more help on this area or things like that? Do you plan
Absolutely,
that?
absolutely. I think that after I return from this brief trip, I would like to go back again in the fall. But in the meantime, I have been in contact with many people in many different communities and asking for donations to Nepal for relief, but also talking with people that I've worked with in the past who are very involved in global health and asking them, how can we be more effective and what can we do? And is that in trying to prevent infections? Is that in trying to heal the community in some way, education? How do we go about this? How can we best do it? And so my goal will be to contact people that I have known at several of the big medical institutions here in Baltimore and ask them what can we do and how can we do that. And I would love to continue to be of some support in that process as we move forward.
So I don't have any words of gratefulness, I would say, or thankfulness to you for taking this initiative to go to Nepal and assess the situation and come back and recommend the health sector organizations as to what could be done for Nepal. I would like to really express my sincere thanks and I wish you good luck and stay healthy and well while you are in Nepal. Thank you so much for joining us with the American Conversations.
Thank you. We hope to get the word out. I think that's the most important thing at this point.
Yes. Thank you so much. The audience, we just wrapped up our conversations with Ms. Patricia Shannon Jones. Her plans to go to Nepal, assess the situation, assess the necessities, come back to the United States, knock on the doors and tell the concerned authorities or the bigger health institutes as to what could be done for Nepal when the Himalayan nation needs in this time of crisis. With this, we would like to wrap up today's American Conversations. Namaste.